My name is Rhian Mannings. I'm the CEO and founder of To Wish, a bereavement charity supporting those affected by the sudden death of a child or young adult of the age 25 years and under. The charity was established after my own personal experiences of losing my son suddenly in 2012. George fell ill at home, was rushed to our local A&E, where doctors and nurses tried to save his life. But unfortunately, within 2 hours of being admitted to the hospital, he passed away. We left the hospital with a piece of paper with phone numbers on of charities and organisations that were supposed to help us. The following day, the family we had around us called those phone numbers over and over again, sometimes receiving answer phone messages, often speaking to people who promised to return their call. But unfortunately, 14 years on, not one of those phone numbers ever reached out to support us, and we were very much left alone. Over the following few days, we were lucky to have family and friends around us, but nobody professionally reached out, nobody called us or knocked on our door. And 5 days after losing George, my husband Paul walked out of the house, leaving myself and my other 2 children on our own, and took his own life. Still, nobody reached out to us. Nobody supported us during that darkest time when we really, really needed support. And it's left to people around you to offer that support when they themselves are struggling. To Wish was established soon after to make sure this never happened to another family. Yes, children do die suddenly, even though you don't want it to be one of your own. But daddies should not walk out of the house and never come home. Losing George had this profound effect on all of us. We had to then cope with losing Paul and George alone, and nobody was there to look after us. I wanted to ensure, through To Wish, that families felt supported. Over the following years, I spent a lot of time walking around hospitals, meeting people, speaking to police officers, other people affected by the sudden death of a child. And through those conversations, To Wish grew and has now grown into a very special, amazing charity supporting thousands of people. Our journey with the family starts with that memory box at the time of death that we've trained staff in A&E departments to use. We check there are facilities for families to sit in, hopefully wait for good news, but unfortunately often receive bad. We want to make sure there's a room for those families to sit with the loved one after they've died too. We then offer 2 types of support. We support families ongoing for as long as they need through counselling, complementary therapy, coffee mornings, social events, anything a family needs. They come to us and we wrap our arms around them to know that they're not alone, that it's okay to live again, to move forward with their grief without feeling guilt. But we then have our immediate support pathway, which we rely heavily on the police and health boards to refer into. With this referral pathway, we speak to the staff, and we've trained staff in both the police and in the hospitals to ensure that if there is a death of a young person aged 25 years or under, with parental consent, their name, their information can be sent directly to To Wish, and we will reach out to them within 48 hours to offer support. We will then offer them a home visit, messages, email support, whatever that family would feel beneficial. Losing a child is something no family should ever go through. We support anyone affected in the family, but also friends of that individual, colleagues, witnesses of that incident, and also the professionals. We need to look after our blue light services and other people that are affected by the sudden and often traumatic death of a child. Thank you for listening about To Wish. All our information is now on the screen, and if you'd like to have some support for yourself, or you know of a family who may also need support now or in the future, please reach out. And together we can ensure suddenly bereaved families get the support they deserve.